Hello YouTube, it's Logan. So today is Wednesday, May 28th, 2014, and yesterday I made 4 months on tea. I'll talk a little bit about changes real quick. So obviously my voice has gotten a little deeper. I've noticed a lot more hair on my upper thighs and on my stomach, and I have one little bitty hair coming out right here on my sideburns, but and maybe like some fuzz going on up here. Other than that, no real facial hair. Let's see. I did up my dose to 100 milligrams weekly. Since then, I have noticed a increase in like frustration and just aggressiveness in general. So I'm gonna talk to my doctor about it. I'm gonna kind of wait it out a couple more weeks to see if it kind of calms down a little bit, but I might talk to her about possibly going down to like a 75 milligram, so we'll see. I've also noticed that I'm like I feel more flatlined, I guess. Like I'm not, it's harder for me to feel emotion at all. And if I do feel emotion, it's usually aggressiveness. Anyway, other than that, I am at the Hilton Inn Gardens in Fort Lauderdale, Florida, awaiting top surgery. Tomorrow is my top surgery with Dr. Garramone. I'm having it at 2 p.m. and I have to be at the surgery center for noon. Which is kind of late in the afternoon, and I can't eat or drink anything after midnight, so that kind of sucks. But other than that, I'm happy with that. I get to sleep later. I did have my pre-op appointment with him today. It went really well. It was scheduled for 11, but we didn't actually see him until like 2:30-ish because he had to have a surgery or do a surgery in the morning, and he was a little behind on his scheduling. But I did get to meet a bunch of guys in the waiting room, which was fun. Actually, 2 of them will be staying at New Beginnings, and I made some other friends, some of which are going to the Philadelphia Trans Health Conference. So that was really awesome, and I'm really looking forward to spending the next week with them and getting to know them more and their families. I wanted to do, I've only like one other guy has done this before, and I wanted to do a little kind of top surgery supplies, what I brought with me and what I think is going to come in handy. And I'll also talk a little bit about the vitamin supplements that Garramone recommends that I purchased. So let's start with the essentials. Alright. So probably the most important thing that you can have with you is stool softeners. I know that's crazy, but this is your best friend. I actually started taking them last night, and I'm going to take them tonight. So I started 2 days before surgery, and I'm going to take them religiously because the anesthesia and the narcotics will constipate you and you will hate your life. Okay, also I brought Dulcolax laxatives just in case. I would recommend taking this if the stool softeners aren't working. Recommend taking this if you haven't gone in like 48 hours. I would take this because you don't want to wait till the last minute, trust me. Moving on. I also brought some Halls with me in case my throat is hurting me from after the anesthesia, and they put like a tube down your throat to breathe. So I noticed last time I had surgery that my throat hurt, so I brought these. I also have my testosterone with me. I did not take a shot this week. My endocrinologist told me to hold off on my shot before my surgery. So I will take it again on Tuesday.
My arm hurts.
I also brought dry shampoo because of reasons. You can't shower for like 7 days, which sucks. And I don't like my hair to be oily, so I brought dry shampoo. And Neosporin for my drain wound after I get it out. Also, necessity, Benadryl, because apparently it itches. Like all the bandages and the incisions and stuff itch. So I have Benadryl. I also have problems with nausea and vomiting after surgery. So I brought some Phenergan with me that I had left over from It's actually like a couple years old, but that's okay. Don't use expired drugs. I'm not supporting expired drug use. But Garramone actually gave me. This is what he gave me. He actually gave me some Zofran. I only have 4 though. It's 8 milligrams, which is a pretty high dose. So hopefully I'll only have to take 1. Obviously, you just want to take 1, but I won't have to take the Phenergan as well. He also gave me Keflex, which is an antibiotic. You have to take it 4 times a day, and I'm going to start tomorrow. And just make sure you take all of it. And then he gives you some Vicodin pain medicine, which I'm not a big narcotic fan. It just makes me throw up, so I probably won't take a whole lot of them. Also, you do not want to take ibuprofen for a few weeks after surgery, so do not take ibuprofen. FYI. He also gives us this, or you have to purchase it actually, this vitamin supplement package. It's bromelain, which is found in like pineapple. It's a natural supplement. This helps with the inflammatory response, and it'll help with healing. I believe I'm supposed to take, it's 2 capsules 3 times a day, and I think I'm supposed to take the first dose tonight. I think. And then also there's arnica. This is also a natural supplement. This helps with bruising and swelling to reduce that. And it's 3 tablets 3 times a day, and I think these are sublingual, or you put them under your tongue and they dissolve. So I'm going to start this thing tomorrow. I'm going to have to ask about it, but that's that. Also, necessities. Let's see. I have some more things. I'm very prepared. I've heard that straws are necessary for after surgery drinking, not alcohol.
Bendy straws.
Bendy straws. I got My Little Pony Band-Aids. Thanks to my girlfriend. Thank you. Scissors to cut your bandages. Trust me, these are actually bandage scissors because I'm a nurse and I have these. Also, another really important thing to bring is wipes. I have wipes for everything. Butt wipes, other part wipes, face wipes, and I have face wash, and I have all kinds of just, I have smelly good stuff, smelly good? Some body spray and the like, and deodorant, because I'm gonna stink really bad, and I don't want to stink because I hate to stink. I also purchased Icy Hot. Well, I didn't purchase this. I had this already. Icy Hot, because you're going to be hunched over, and your neck muscles will probably be really sore, and I just want this just in case I have sore muscles. I don't suggest putting it anywhere near your chest. Your lower back or your neck and stuff is fine, but don't put it near your incisions at all.
My arms hurt.
Almost done. I also have some Dial antibacterial soap that I will use tomorrow morning prior to surgery. You want to shave under your arms because, one, it's just more sterile for surgery, but also because the bandages are going to be right here and you don't want them to stick to your hair because that's miserable. And no deodorant the day of surgery. And nothing to eat or drink after midnight. But those are obvious. Last thing I'm going to talk about is Scar Guard, which I also purchased from Garramone. He says to start this about 2 weeks after surgery. So you basically just apply it. It's a topical application. Apply it to your scars. I think it's once a day or so until it's done. I'm probably going to use this more than once. This is just one box. I'll probably buy this silicone strips after I'm finished with this. So I think that's about it. So my surgery's at 2 p.m. and I will update whenever I'm out post-op. All right, bye. Okay, so I also wanted to mention that, and I don't think I've mentioned this in my previous videos, but I forgot to say that I've also had a breast reduction before. I had it when I was 19, which was about 6 years ago. And it was, I think, the T-anchor technique is what they called it. I had like double D's, so they were huge. And I went down to like a B cup. But it was an incision around the nipple and then down, vertically down, and then under the breast. Which the incisions under the breast are similar to the incisions that Garramone does. But I talked to him about it today. My biggest concern was that my previous reduction would affect my results on my top surgery. And he said that the incisions will be pretty much above the nipple where it is now. And then he takes the graft of the nipple and positions it upward. So that's all going to go away. And then the vertical incision is going to be off. And then the incision under the breast, he said he will be making an incision right below it. So there will be some old scar tissue there from the previous surgery, but that the original incisions will be removed, or at least they won't be visible. So that was reassuring. So I was really happy to hear that my previous surgery would not affect my results. And he said, I asked him if it really made a difference if I would have not had the breast reduction and I would have come to him with large breasts, if it would have made a difference in my results, and he said no, not really. But honestly, I think that because my skin is a lot more elastic, I guess, than it was before. It was really thinned out from just like heaviness over a long time. But yeah, just wanted to add that in.